having said that, Dr. Sarfo, why don't you just, maybe elaborate on yourself, who you are, give the audience a little bit more about yourself.
Okay, my name is Kojo Sarfo. Currently reside in Los Angeles, California. I'm a full-time content creator. I have 2 years of experience with my clinical background as a doctorally prepared mental health nurse practitioner, psychotherapist. I was working in Virginia doing forensic psychiatry for about a year and a half, and in my free time, I was posting videos on TikTok and Instagram to promote mental health awareness and essentially teaching people things that it took me, 8, 9 years to learn, through schooling, and just answering people's questions and talking about my personal journey, as a clinician, and also the things that I've learned in my personal life. It seemed to be something that people really wanted to know about. So being able to do that and through video form is such a powerful way of communicating with people and telling your story. And also a book that I wrote in 2019 called You Already Won. That was like the catalyst, for getting me started as a content creator. So that's what I do now. And I'm here in California, because the city, this is Hollywood. This is where we make movies. This is where entertainment starts. So I decided that this is where I needed to be in order to make a difference. So I took the leap, and I'm excited to be here. And every day is it's a different struggle in terms of reaching out to people and making a difference. But I think we're doing a good job. So I'm proud of what my team and I have accomplished so far.
Amen, and very well said. So we're talking about mental health and certainly mental health awareness. I want to touch back, starting with the beginning. Why don't you tell us a little bit about your childhood? Because I feel that some of the things you went through are just so relevant. Just when you think back to your childhood, what were some of the signs that, you were a little different than other people?
Yeah, so go back to my childhood, in my book, I talk about having ADHD and it being something that I feel like I knew about at an early age, but I really didn't know what was going on. Like I would see kids be pulled out of class to take medications, or I would see teachers, work with a certain individual to try and get them to not be as hyper. And I would go home and I would tell my mom that, like maybe I need to be tested for this or that. And she would say things like, you're the healed of the Lord, we'll pray for you, and you'll be fine. So like just going off of that, like I knew that, I would be fine because I had to be fine. I had no other option. And as I got older, like I realized that I had an issue regulating my attention, which is the core of the issue with ADHD. It's not so much that you can't pay attention; it's more so that you can't regulate your attention. So the thing that you need to do at that moment, you can't do. Fortunately for me, as an adult, I was able to get diagnosed and got the proper treatment, and now I'm a clinician and I can help people who struggle with the same thing. Just feeling, disorganized, taking twice as long for me to do than it would take somebody else. So, even all the stuff that I've pulled off today, like, I'm proud of myself, but it takes like a lot of energy because it's hard to pay attention. It's hard to stick to a certain thing. But that's my experience as a child. And, now that I know, I don't regret anything. Things happened the way it happened. My parents didn't have health insurance and they didn't know, coming from West Africa, Ghana specifically, we don't talk about mental health awareness. So I can't blame them. I have a really good relationship with my parents. They did the best knowing what they knew at the time, so it's up to us, the new generation, to do better with the information that we have.
Very well said. Now, were there any stigmas with you growing up, knowing that you struggled with ADHD? You had the challenges of you. You already mentioned you had the challenge of maybe your parents didn't know, they didn't fully understand what was going on. But were there any stigmas that you faced, be it at home or at school or just with friends?
Interestingly enough, no, right? Because I wasn't diagnosed, so we couldn't put a name to the thing, right? So we didn't know what was going on, So it wasn't even undiagnosed ADHD or anything like that. It was just more, Kojo's a bright student, but he's in a world of his own. He spaces out. He can't pay attention. He's trying to be the class clown, things like that. But it's funny. No teacher, to my knowledge, maybe I have to go back and tell my mom, but no teacher came back and was like, you might want to look into getting him tested for ADHD. Or maybe, like I said, my mom never told me, but we didn't have anything to call it. So there wasn't any stigma for me. I wasn't taking medications for anything. I wasn't being treated for it. So I was just kind of going through life and I didn't have to worry about being, different because like there was no name for it at that time for me. So interestingly enough, I didn't really experience any of the stigma, growing up as a child.
Very well said. You obviously became, a nurse practitioner with a focus on mental health. From your childhood to sort of what you are today, were there anyone who influenced you to pursue that particular field, or to pursue that particular, the mental health concentration that you ultimately obtain? What or who rather set you on that path?
It's funny because with that path specifically, no, there wasn't anybody who I was looking up to. Like, there was no psych nurse practitioner or psychiatrist who I was like, oh, I want to be like this person. I wanted to be a police officer growing up, so I was just kind of go off of what I would see on TV. But in terms of my educational journey, it was my father who, is my hero in that regards, because he's probably the most tenacious and relentless person that I know. He's always made it a priority to pursue his education. So for me, like, I wanted to emulate him, and I wanted to be disciplined and focused, and education was what changed, not only my life, but the life of my family. So I wanted to take it to the highest level with whatever I was doing, and it just so happened that graduating high school at 17, I didn't have a good GPA, and my dad recommended try nursing. He said, give me do a 2-year nursing degree, get your RN, and after that I won't bug you anymore. Just get a 2-year nursing degree, you can take care of yourself. I did it, and I managed to win most outstanding student award. And I realized that, okay, I'm okay at this. Like, I can talk to people, I can help people at their most vulnerable, and that improved my confidence. And I went back for my bachelor's, and then I learned about the DNP, which is the Doctor of Nursing Practice specialty route. That'll allow you to do psychiatry as a nurse practitioner. I didn't even know that nurse practitioners could be doctors and have a doctorate degree. I knew nothing about it. It's just more so of, like, extending myself, and making sure that I could be as expansive as possible and do whatever I had to do to improve myself. And as I kept going, it's funny because people ask me, how do I find my passion? Or, you'll never know your passion. You have to try things, try, fail, fail, fail. I'm here in California to fail and to learn, and to push myself, to put myself in uncomfortable positions. So as I kept going, I learned about different things, and I was working at this psych hospital. And when I went back for that DNP degree, I spent so much time, hours at the hospital with the psychiatrist. And once they figured out that I was, going to school for this, they're like, oh, I'd love for you to, rotate with me, maybe work with me one day. So I spent so much time with the psychiatrists and med students, just talking about different diseases and diagnoses. And, I would spend extra time, talking to the patients. And then I figured out that, okay, I could do this for a career. And then the social media thing happened after that. But I just didn't really know until I began to look into that path. And I saw, oh, you can be a DNP nurse practitioner. And I put all my effort into becoming the best at that.
Very well said. Tell me about, the transition from, being undiagnosed with ADHD to being diagnosed with ADHD. What brought that about? Because I know you mentioned that,
Mhm.
you guys didn't know what it was. And so how
Yeah.
did you all of a sudden put a name to the disease?
Right. So I was at a crossroads. I was in grad school working on this doctorate degree. And, I had people around me giving me praise, saying, oh, man, you're going to be a doctor at 26. You're going to do great. But I was, silently struggling, like having to work part-time. I was still working part-time as a nurse, on the weekends. And then I was trying to sustain a relationship with the girl I was dating at the time, trying to help my family financially, trying to have a social life. And then I had a clothing company I started with my friends. So I was burnt out on all ends. And when it came to studying, I couldn't regulate my intention enough to steady. So I was really struggling on, everywhere. Like, I'm struggling in my relationship with my parents. I'm struggling, my girl is asking, you're not spending time with me. And on the weekends, I wouldn't be able to spend time because I should have studied during the week, but I couldn't do that because I was all over the place. And I spoke to a good friend of mine who was in med school at the time. So we were always studying, and he said he had ADHD. He said, he has different provisions where he gets more time to take his tests. Talked about his therapist, talked about the meds that he was taking. And I figured that I had nothing to lose at that point, right? To go and get checked out. And if the doctor said I didn't have it, then at least I can live with the fact that I tried to get checked out. But I got assessed by my primary, and then I got diagnosed. And then after treatment, it was liberating, right? Because you can put a name to the thing that's ailing you, right? When you don't know what it is, you think you're dumb, you think you're lazy, you think you're unmotivated. But then you finally have a name to it. You're like, all right, this is the thing that's going on. And then that it boosted my confidence because then instead of me putting it on myself, right, the negative self-talk, I'm like, oh, this is something that I struggle with. My frontal lobe might be a little bit different from other people. I might struggle with executive functioning, but I'm not smarter or dumber than them. It's just the way I'm made. So I just need certain accommodations in order to, be the best version of myself that I can be.
Very well said, brother. So now that you put a name on your challenge, if you will, ADHD, was there any sort of hurdle or obstacle? Sometimes when in the world of health, when you diagnose something, it might just be too shocking for some people, and some people
Mhm.
just don't want to believe that, well, this is what I have. It might
Mhm.
be something else. Was there any sort of deterrence from you just sort of accepting it, or were you with the knowledge you knew,
Mhm.
were you I guess, were you in denial, or were you ready to accept it just because you sort of suspected that
Right.
this was ADHD?
Yeah, it was liberating for me. It was more so just a confirmation of what I already knew. Just that without the diagnosis from a qualified healthcare professional, you can't really say you have it because it's just suspected up until that point. So once I got diagnosed, it was liberating for me. It was more so confusing for other people at the time to figure out what was going on. Like the girl I was dating at that time, like when I would tell her that, I had ADHD and this is what the doctor said, she was, like, oh, you don't need that. You don't need those meds. Isn't that what they give kids to make them zombies? Or I don't know if that's a real thing. So my mom the same way trying to understand it. My dad's like, what's going on? So like the people around me, it took them a while to understand, and that's fine because like it's a learning journey for all of us. But for me specifically, it was more so liberating. I was ready to go. From the moment that the doctor told me, it's kind of like somebody pointing out the obvious, and then you're like, okay, yeah, I know that. I'm just waiting for you to confirm it.
Mhm. Well said. So now we have you with a confirmed diagnosis, and I'm sure you're getting some sort of therapy for it.
Mhm.
And then you have the you prior to having the confirmation and therapy. What are the differences in sort of how you deal with attention? What differences have you noticed? Are you more productive? Are you more focused? Are you able to manage things better?
Right. So for me, like especially during grad school when I was taking medications, it helped out with executive functioning. It helped me focus, helped me do the thing that I came to do. So if I sat down and I'm looking around, like, all right, I'm here to do this specific thing at this time, I would do that thing. Whereas beforehand, I would come to the library, I would open up. Like this is what I would do. I would open up my laptop and I knew that I had to study for psychopharmacology, right? So I knew I needed to review mood stabilizers, but I would open up my laptop and I would type in Chris Johnson, Tennessee Titans highlights, and I would watch football highlights for a few hours, and then I would get to my task. And then my mom would be like, "Why aren't you home? What's going on? Or are you gonna be late to work?" And then my girl was like, "Oh, you forgot to do this," like, and I'm like, "Oh, I did forget. I didn't." Not that I'm not making you a priority. I just kind of got sidetracked. So, with proper treatment, I was more so like, all right, I'm sitting down. I know what I have to do. And I can't live my life like everybody else, but I have to, the therapy helps too. Medicine therapy, all those things help. And even today, like if I'm like going about my day-to-day affairs, I know that I want to post certain amount of TikTok videos every day. I want to educate somebody about this, and that. So I need to wake up at early time before other people in case I waste some of my time. I'm still being productive. I need to get to the gym and work out in the morning and get myself going. Does that make me feel good? Get a good nutritious breakfast. Can't skip that. At the very least, if I can't work out, take the dog for like a nice little walk. And after I take a shower and I come back and then I sit down to do the thing that I have to do, I'm more so focused and I can get my affairs done. So just being mindful of the things that I have to do. Maybe other people don't have to be mindful of this or exercise or eliminate processed foods from their diet. But I have to do certain things in order to make sure that I can, be as efficient as possible and operate at the highest level.
Just hearing your story hits close to home, especially with the cultural aspect of things. I know that, again, being West African myself, you know, we do have stereotypes. We do have things, stigmas, if you will, with regards to mental health. A lot of it does come from the fact that we aren't aware or aren't as educated. And many a times we don't even know what sort of tools and resources are available out there in order to, let's say somebody had a child or has a brother or sister or somebody in their family. At least from what I know about my culture, we're not the most competent with all of the resources that are available out there. So with that being said, with everything that you're doing now, what I find is that you seem to offer people a resource is primarily in the realm of education. A lot of your videos, and I've seen quite a few, a lot of your videos center around educating people around, what to look for in someone who may be dealing with ADHD, but in other things as well. How would you say is the importance of what you're doing and really the importance of recognizing symptoms that are displayed when somebody has a mental health challenge?
I think education is important because a lot of times, like people feel alone when something's going on, but they don't know how to recognize a certain thing. And like I'm not the first to do this. Like there's people who are doing it currently, people who've done it before me, people who do it after me and may even do it better. But like if you go on YouTube, they'll talk about these very same things, but at the same time, there's a disconnect, especially within psychiatry, to where people don't trust the providers. So when you come as yourself, so me coming as Kojo, not Dr. Kojo, and putting the information out there to where it's educational, but it's also informative. You also make it funny as well. Sometimes you need like a break from like the hardcore information, or you can't take the DSM-5 and throw it on TikTok. You have to break it down, use the trending song, make it funny, smile, laugh. At the same time, you want to make sure that you're driving a certain point home to the person on the other end. So when people are, watching 8-second clips and they're passively learning, in today's society where like we don't have time to really waste, everybody's busy. So nobody really wants to watch a 30-minute YouTube video of me explaining something. So if I can explain what used to be, what used to take 30 minutes to do in 7 seconds, and I can do that with a couple of videos, then people sometimes some folks watch just to see the dance, right? And they'll say, "Oh, you're a little offbeat." I say, I know that, but I'm trying to get a certain point across." So if you can explain things to whereby people are passively learning and people are taking in information, they don't realize that they're learning, right? Because nobody wants to be sold something, right? You don't want to like sell a certain product and say, "Hey, buy this for 19.99," or you don't want to educate people and say, "Hey, come sit down, let's talk about this." But when you put it in their face and then they realize that, oh my goodness, I'm laughing, but I'm also learning, I think that's a powerful thing. So once I figured out that I could do that, I start to watch more trends and patterns, and I'm always asking myself, the person on the other end, like before I hit post, like what is this video going to do for them? Like they don't care about certain things and certain things they care about. So how can I mix everything up to make it an experience? So those are things that go through my head when I'm posting a video.
Excellent, excellent. And I think your reach is a million plus actually on TikTok alone. And but then you also have followers on other platforms. So I think
Right.
we have to commend the work that you're doing because the passive learning is the way to go. I know that I can't sit still and watch an hour long video on something. I'll be
Right.
skipping through and just getting to the meat of what I want to learn.
Right.
I think the platform that you use is actually amazing in teaching people things that they wouldn't otherwise commit that length of time to learn.
I
So
appreciate
that's
that.
that's really amazing. Now, for those who may be watching this, both now and in the future, who may again have someone who's dealing with mental health or who may themselves be dealing with mental health challenges, what are some of the resources that you're aware of that are available out there that you would point them to?
So I always tell people, one of the greatest, signs of strength is reaching out and asking for help. So, if you're asking yourself, like, do I need to get help, or do I, maybe I could use a little bit more support. At that time, it's good to, like I always tell people, you want to build an environment for you to succeed, right? So if you're somebody like, Let's say you're LeBron James, right? In your environment, you want to have people who are pushing you to work out, to keep your body in the best shape possible. People who are also playing basketball, people who are supporting you. If you're a father of like three, he has three kids, you want to be around other fathers so you can be the best father, be around other ballers so you can be the best baller. So if you're somebody who you're struggling with, like let's say you're struggling with depression, you want to be around people who maybe have lived experience, who can talk to you. Like your support system needs to be of people who are going to encourage you, people who won't make you feel bad because let's say you've been ghosting somebody because you're in a depressive episode, people who will support you and uplift you. And professional help is always the right answer. Like as a qualified and licensed healthcare professional, I'm always an advocate of professional help, whether it's a therapist, primary care provider, psychiatrist, nurse practitioner, PA. I always advocate for professional help, but that alone is like that's like the first step. But you get that help with it, and then you take the meds or therapy. But then you want to, construct an environment where you can succeed and thrive. So the things that you struggle with, maybe have your friends who are, good with that help you out. Utilize the people in your life. Be open and transparent and vulnerable with those who you feel like you can do that with, and those who also reciprocate that back to you. So what? And I always ask a specific question. I always say, what does self care look like for you right now? And this is September. Self care was different for us, like what 3-4 months ago, right? We thought we were towards the tail end of the pandemic, and now there's all these new variants, right? So now you might be a little bit more anxious. So it's always good to do those check-ins with yourself, even if you're feeling good, right? And I think therapy can be beneficial for anybody, right? You go therapy for a little bit, you learn some new strategies, and then after you graduate, and then you come out better, and you might go therapy a little bit later again in your life, but it's not going to hurt to try it. And these are unusual times that we're living in, with the pandemic and everybody working remotely. I have never seen nothing like this. And a lot of people who are much older than me haven't seen, unusual times like this. So I think anybody can benefit from, just taking that break to, assess yourself mentally. And, it's so important to realize that the best time to check in with yourself, check in with yourself mentally is before there's an actual problem, right? Once there's a crisis, it's much more difficult. You might have to go to the ER, whatever you're struggling with. But when you're feeling okay, that's the best time to do some maintenance work because you might learn that okay, I can fill in the gaps here, and there's certain things that I was doing that wasn't promoting my health to the best of my ability. So I think there's never a wrong time to actually check in with yourself.
Well said. So you briefly mentioned COVID. You briefly mentioned the pandemic that we're currently going through. And I know for a fact that early on when they did the first lockdown, I mean, that took a toll on my mental health and my sanity, just because, all of a sudden you couldn't see your friends, you couldn't go out, you couldn't, socialize like you did prior to. And I know, I'm someone who's pretty good health wise and don't have too many health challenges, thank God. But that took a toll on me, and I could only imagine someone who does struggle with mental health
Hmm.
challenges, how much worse that would have been for them. But what are some things that you did in order to cope throughout this pandemic? How did you handle yourself, and how did your mental health, well, let me ask, did your mental health suffer? And what are some strategies that you use to ensure that you sort of alleviated your mood and your health as well?
Well, yeah, it was definitely a mental health challenge for me, because I was working in Virginia and I was living there by myself. And, my family was split between Tennessee and Georgia. And, I actually gone through a breakup during the pandemic. So I used to have the girl I was seeing at the time, she would fly in from Georgia a couple weekends out the month. But then after we separated, it was just me and my thoughts. So some of the things that helped me were I went to therapy for the first time. I always talk about it, but I went for the first time when I was during the pandemic. I also reached out to family members and friends via Zoom. And sometimes I would call, like I would text the guys, and then like we have like a Zoom meeting like this where we just get up and we go around and like like I'll be like, hey Mike, what's up? What you been up to? Like I see you posting with a new girl on Instagram. Just catching up with the guys and laughing because we used to be able to do that in person. I used to be able to catch a flight and go back home to Atlanta for the weekend and hang with the guys. I couldn't do that anymore. So using Zoom technology, FaceTime, we'd have like Sarfo family FaceTimes where it'd be all of us and then we check in and we'd be laughing with each other. That was very helpful. I was spending a lot of time on TikTok building my brand. So it was actually helpful for me to go on there and go on TikTok live and talk with the community. And now do check-ins with people and say, how are you doing? And likewise, they'll ask me how I'm doing, and we just talk about life. And, I cut back on, like every now and then I have some wine on the weekends, but I cut back on alcohol and things that I felt like I would maybe depend on too much, because I realized that, okay, if you're by yourself, this is a time that you might start to lean more on these vices. So I cut all those things out. I started going to the gym more, just running, just playing basketball, watching sports, things that I could do to keep me connected with family. Because it was about like a 4 or 5 month period where I couldn't see my parents or family members. So that was definitely hard. The silver lining is that some of the strategies that I've learned back then are ones that I can use again, depending on whatever happens in the future. So, I'm prepared and hopefully, we don't go back to another lockdown. That'd be, awful. But whatever happens, I feel like we've gone through this once. So we're just preparing for like whatever unusual circumstances lie ahead for us.
So sad. Well, let's talk a little bit about nutrition. Earlier, you mentioned that you had to sort of be mindful of what you ate, and just now you just mentioned you had to cut back on alcohol. What is the role of nutrition in terms of mental health? I know that many a times it can be used as a crutch. I know they often said that when someone's sad or depressed, they either turn to sweets or alcohol. But let's talk a little bit about nutrition, whatever you know. How important is that in just dealing with and maintaining your mental health?
It's quite important. The gut and the mind connection is important. The majority of serotonin, is stored in the gut, and that's how a lot of antidepressants work. So I don't think I don't want people to think that you can, like, if you're depressed and you stop eating, like, you fix your diet, that's going to cure depression. Because sometimes people think that, oh, I don't have to take meds or do any type of extra treatment. I can just fix my diet. I think that helps out a lot, but I don't think foods necessarily make you depressed. So I wouldn't say that, fast food and burgers, they don't make you depressed, but it can make your struggle to overcome depression a little bit harder. So it is important to be mindful of the things that you are putting into your body, but at the same time, you can't beat yourself up. A lot of times people struggle to afford nutritious food. It costs money to eat well. It costs money to have a dietitian. It costs money to have a primary care provider and a whole team of people who are watching what you eat. So I don't want folks to get, too down on themselves and beat themselves up for whatever they're eating, but just be mindful that, if you are struggling with things like anxiety, depression, that the type of food that you consume, it could make it, that much harder to overcome. So just, take your time, work on one thing at a time, because that's a practical way of, improving yourself. It's tough to tell somebody who is, who already can't afford, nutritious food, and, fast food is cheap. And it costs money to go to the grocery store and get good food and organic food and this, that, and the third. So it's important for people to know, okay, how can we, if we're balling on a budget, what are some of the things that we can do to, take a step in the right direction? So I'm more so, I do understand the gut mind connection and that it is important to be mindful of what you eat, but at the same time, we have to be practical as well, because the way foods and fast food and the cheap good stuff, the way that stuff is advertised on TV, and the way our system is going to make it to where it's going to be hard for you to eat the things that you need to eat to keep yourself, keep your body running at the best possible condition. So that's what I would say for people who are struggling with that.
Very well said. So let's talk a little bit about your clinical experience. Obviously you focused on mental health. What has that been like as someone who is essentially dealt with this, and now you're sort of helping people who are struggling with some of these things? What are some of your experiences, and just with some of the patients, some of the more interesting ones? What can you say in that regards?
So I think, just from a standpoint of empathy, being able to like understand the patients, especially working back in Virginia, I was working on an NGRI unit, which means not guilty by reason of insanity. And a lot of these individuals had committed crimes, but because of their mental state at that time, they were not guilty by reason of insanity. So instead of them being in jail or prison, they were at the psychiatric facility receiving services, and a lot of them were preparing for conditional release, and they would be released conditionally back into the community, a lot of times under supervision based off whatever crime they committed. A lot of those individuals were Black males too, and I think it was very I think they were inspired just to see me, as a Black healthcare provider, and a lot of times they would tell me certain things like, I feel like doctors treat me like a guinea pig, or they're putting me on this med and that med and this med and that med. So just seeing me and just knowing that I was willing to understand, and a lot of times, being a minority myself and having my own struggles, like I understand how hard it is to be on that side of things, to where nobody really believes you and you have to advocate for yourself. So sometimes just the small things like listening. Maybe I wouldn't switch up the treatment plan or switch up the meds, but just listen to a patient and letting them know that they're heard and that they are a part of their own healthcare treatment plan. I think that did like a world of difference for them.
Well said. Now, you're dealing with a lot of Black men, in this unit. So let's talk about it. What can you say regarding, we just briefly touched on West African, but generally African stereotypes with mental health. For a lot of us, and I can't generalize for everybody, but I certainly know that, for my family, we're just, this isn't something we're privy to. And so it's one of those things that we sort of have to learn to approach a little different than what we typically do. But with African Americans, what can you say to them, and sort of the stigmas that do exist in those communities with regards to mental health? If you could tell that community and other communities as well, if you could tell them one thing that would help them better, better treat or better approach their children or their loved ones who may be struggling with mental health, what would you say to them?
To just begin a conversation, if there's anything that, that used to be taboo, find a safe space to talk about it. Especially with Black males, we don't really talk about our issues. So I think, like in my group message with the guys, we've really come a long way where we'll stop and, whether we're sharing Bible verses or sharing a sports highlight, sometimes, one of the guys, Greg or Mike or, anybody will leave a message and say, hey, how's everybody doing? I heard, so-and-so's family's going through this. Are y'all doing all right? Like, what's going on? What's good? What's up? And it's important to have those conversations in a very informal way, because it allows people, like, you never know who is struggling with a certain thing that they may not even be able to talk to their close friends about, right? Because you're afraid that if you tell one of your close friends that you're struggling with this, what if they share that to the whole world, right? And then your business is out there. So just providing that safe space, I think, is so important for us. I don't think we're properly represented, in the mental health landscape, and even something like the DSM-5. I often question how well it represents, Black males. A lot of times we're more liable to misdiagnosis. We're more likely to be seen as aggressive than our white counterparts. So we're already fighting, like a uphill battle. So the least we can do is start that conversation. And the more you have, Black men, women going to seek help, then we can have more evidence-based information, which will dictate treatment for us. So it's just important to start the conversation, and that'll help break the stigma. And so many people will be saved by it, right? Let's put our pride to the side. And once you break stigma, there's no longer that shame, right? It's the shame that prevents people from going out to get help, because people will rather they'd rather struggle and suffer however they're suffering than to go out and get help if it means that they're going to be ashamed, right? So
Mhm.
it's important to start that conversation.
Yes, sir. And you mentioned DSM-5. I just want, everybody to know that stands for the Diagnostic and Statistical Manual for
Right.
Mental Disorders.
Disorders, right.
And that's sort of like the handbook for mental health
Right.
professionals. Am I right?
Right. That's like the Bible in a sense of psychiatry. But it's like the manual, the guidebook. in terms of everything that psychiatry is based upon.
Mhm. Thank you for that. I noticed, throughout your throughout this interview, you continually mention your supportive system, your friends, and how important is it for you and certainly for anybody who's struggling with mental health to have that supportive system in terms of friends and even family.
It's so important, especially in a time like now. Like I said, these aren't usual times. It's important to have people who only will support you, and obviously, like with this big, social media platform, like you have people coming here and there, and it's hard for me to even keep up with messages and stuff like that and emails. So I have to have a team of people helping me out with that. But obviously, there's like those 12 to 15 people who are in your circle who, if they call you at 2 a.m., you'll pick up. And those are the folks who like I really count on to lift me up and likewise lift them up. And it ranges from people as young as my 16-year-old brother who will call and just check up on me and just see what's going on. And we might play some video games, play Madden up there. To some of the older guys like the OGs, some of my friends in the 40s and 50s that I look up to. I'll call them, they'll call me and just see what's going on. And, it's a no judgment zone, literally. We can talk about anything that's going on. Certain things as men we struggle to talk about, right? Like our health, relationships, with the women in our lives or our finances. Like if you're struggling in any one of those categories, you're not really going to go tell anybody, right? Certainly as a man. But when you have that safe space to where you can talk to, your guy friends and say, hey, this is what's going on, or, I'm struggling here and there. That's the most liberating thing because we never used to have that, right? You would open up about something and, especially like in your teenage years, it'd be like a running joke. So you would know, good and well to never talk about any struggles that you're having. So just having that support system of people, I'm not going to have anybody in my life who is not going to support, and even if this is a family member or somebody who I'm close with, if they're disrespecting boundaries or, if after interacting with them consistently, I don't feel as good about myself, then, sometimes you have to cut people off, but you can spend less time with them. So you just have to be very intentional with the support system that you create.
Very well said. You already won. It's the name of
Yes,
your
sir.
book, Amazon bestseller. Why did you write the book?
I wrote the book because I wanted to tell my story. I was ending a chapter in my life where I wrapped up the doctorate degree, so my educational journey had come to a close, and I was stepping into this new phase of my life where I was going to begin, this next portion as a clinician, and I figured that I was like a good place to tell my story because I felt like I had gone through a lot. And I felt like right there and then I could help out people. And this is before TikTok, before like all of the social media success. I felt like I had a story to tell back then, and I had gone to a funeral the February 2019 for a good friend of mine's mother who passed away. I was in Toronto, and I remember one of the women there was talking about my friend's mother and saying, if you don't tell your story, someone else will. And I was in the middle of writing my book at that time, and that really hit me. It hit me different. I was like, "Oh, I gotta get this book out." And I felt like I had an incredible story up until that point because I felt like I had beat the odds, and of course, I worked really hard. But a lot of things had to go right for me to get to that point where I could get my doctorate at 26 and be able to help out people. So I felt like it was important to tell my story, from myself, and also it was cathartic for me just to get it out. Any past trauma I'd gone through, just get it out. Was part of my healing journey, and then it also prepared me. I felt like that prepared me for my social media success because I talked about struggles in relationships. I talked about ADHD in the book, right? And this book has been purchased by so many people in people's living rooms, in their bedrooms, right? So the things that you write in the book, it's printed out and is distributed by Amazon worldwide. So you can't take back those words. Those words are in people's living rooms for years, for life, right? So when I put my story out and I was open about ADHD and open about my struggles, there was literally nothing else that anybody could say that would embarrass me. Like I had nothing, nothing really embarrasses me, or I'm not ashamed about anything online because that was the thing that I didn't want to talk about. So I put it in the book, and it set me up for success in all other parts of my life. So I have to really credit that book as a catalyst for a lot of the success that I'm having right now.
Well said. It's currently an Amazon bestseller. Why do you think it's been so well received?
I didn't pull any punches with the book. I told my story. I was straight up. I was, vulnerable. It came from the heart. And even the part where I had ADHD, like in chapter 9, that's the part that I wanted to omit from the book after the book was done, after it was written, because I thought for some reason that if people knew that I had ADHD and I was taking meds for it in grad school, that they would attribute any future success to that, right? So like I was sitting there thinking in my mind that like today I've become successful, all these followers, and living in Los Angeles, in Hollywood, blah, blah, blah. I thought that somebody would, find out mysteriously, oh, he was taking stimulants for ADHD in grad school. That's why he's successful. That was like my biggest fear, honestly. And I wrestled that decision for like a week and a half. And afterwards, I'm like, no, this is my story. This is what happened. And once I made peace with it, there's nothing really else that could like shake me. So I think leaving that part in the book, people could tell that I was telling the truth. Like, there was no, as the young folks would say, there's no cap in my game. Like I was telling the truth. And I think people are inspired by that. So, people like who you are more than what you do, right? So whatever you do, doctor, blah, 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 the accolades, like they care about the individual behind all of that. So just by being me, as open, authentic, raw, and transparent, I think people appreciated the authenticity, and that's what drove the book sales up. And of course, TikTok, right? Like when you have so many followers and people, you have the link to the book in your bio, like that's probably the correct answer, right? Like people found out through TikTok. But also word of mouth. Once people read the book, they realized that it was actually a good book, and that it was something worth reading.
Very well said. You have a presence on social media. We mentioned TikTok, some of the others. What is your handle? I want you to give the audience sort of how they can reach you, how they can find you, be it by a personal contact information that you're willing to share or social media handle.
Right. So on TikTok, it's at Dr. dot Kojo Sarfo, KOJOSARFO. On Instagram, it's at Dr. Kojo Sarfo, at Dr. Kojo Sarfo. And then on YouTube is just youtube.com/Kojo Sarfo. Those are my three main platforms that I'll be working on to push out the content, the podcast, and things like that. And you can give me a follow there and keep up with some of the content that we're putting out on a daily basis.
Excellent. Last question from me, and then we'll take some from the audience. I'm just going to read some statistics and then I'll ask the question. So the most common mental health illness in the United States today are anxiety disorders, and they affect about 18% of the population. Suicide is the second leading cause of death among people aged 10 to 34 in the United States. More than 70% of youth in the juvenile justice system have a diagnosed mental illness. In late June, 40% of US adults reported struggling with mental health or substance abuse. 1 in 6 US youth aged between 6 to 17 experience a mental health disorder each year. And I think we can all agree that the COVID pandemic, with the shutdowns and restrictions and everything, have made these statistics worse. What can we as a society do to reduce these statistics? What can we do as individuals, and what can we do as a collective to better address mental health in the United States?
Tell the truth, like if you're feeling a way, be open about it. Because, more often than not, like people are feeling the same exact way that you're feeling, but we're all just like looking around the room waiting for somebody to, to start the conversation. And it's not cool until somebody starts and then we start adding, our 2 cents in. But tell the truth, be open and transparent, and encourage other people to go get help. And if you've benefited from psychiatric services or therapy or a friend who helped you out in a rough time, if you tell your story, your testimony becomes the encouragement that somebody needs to go out and get help. like if you withhold that information, like, you withholding information that could potentially save lives. So sometimes it's just reaching out to people in your circle, in your community, at home, at work, school, church, or even online. Like anytime you take a phone, you take a phone and then you put it in front of your face and you start to talk about your story. At that point, you become a mental health advocate, I'd say. So it's important to, never disregard like your story, like your personal testimony is so powerful.
Very well said. I want to thank you, Dr. Sarfo. I'm
Mhm.
going to go ahead and ask everyone in the audience to unmute themselves. If
For sure.
if anybody has a question for the good doctor, please go ahead. You have the platform. Okay, I'm going to read you one that was in the chat. Okay, so this one comes from Eddie Clark. It says,
Mhm.
with challenges undiagnosed, how did you succeed with not knowing in school, though not having the best GPA? So I think he's
Right.
trying to say, how did you become what you are today, despite not having the best GPA while it was undiagnosed?
Right. So it was rough. It was really hard. And I mean, I got my confidence was like at an all-time low. And I got to the point where like I knew I wasn't dumb, right? I knew something was going on, but I wasn't dumb, but I just needed an opportunity. So fortunately, a lot of luck, right? I would say like I did a year of prereqs at South Alabama under the guidance of my dad. He was like my guidance counselor. So having a supportive father and a supportive mother like that meant the whole world to me. Like without my dad, there's no Dr. Kojo Sarfo. There's no big platform and millions of followers. So just having that parental guidance was huge for me. Like he put me in the right direction. And I did okay my first year of college after not doing well in high school. And we only applied to one nursing school. I only applied to one. I didn't apply to any others. We just applied and said, let's just give it a shot. And I got accepted to that school. And when I realized that I got accepted to the University of West Alabama, that for me was like my opportunity, because I had gone through 4 years of high school where I was like a bad student. People doubted my abilities, and I'm like, I'm not dumb. I just need like an opportunity. So once I got accepted into the University of West Alabama into their nursing program, and they went off of ACT scores, not GPA. And my ACT was like decent. I think it was like a 22. Wasn't the highest, but it got me into the University of West Alabama. And once I got in there, I knew that I wasn't going to be outworked. I got to campus in Livingston, Alabama. I shut down my Facebook for like maybe 6 months. All I was doing was studying, going to the teacher's office, once a week, working out. I was making friends, but I was so focused because I had already like gone through like a 4 year stretch of being like a failure. So I just told myself that once I got that one opportunity, I wasn't gonna look back. And that one opportunity, that one acceptance changed my life. And I never looked back, and I just kept going. And obviously, as I kept doing, well, it improved my confidence. But when you're stuck in a situation like that, you have to mentally prepare yourself. Whatever breaks that go your way, take it, because more than likely you're gonna have an opportunity to change your life. And the worst thing that can happen is the opportunity like comes your way and you're not ready to capitalize on it. So fortunately for me, I was ready to capitalize on it, and I still have that that bad taste of being like a failure in high school. I still remember it, everything people said to me, the things that they thought I could and couldn't do. And it still kind of motivates me to this day.
Said. Does anyone else have a question? You can unmute yourselves. Okay, I'm going to go ahead and read another question here that was typed in. Someone asked, is it necessary to take medications to treat ADHD? Or essentially, are there alternatives to treating other conditions which will allow you to function normally?
It's a great question, and that's a personal decision between the patient, and their family, depending on how old the patient is, and the healthcare provider. Of course, you take the healthcare provider's recommendation. Some people have heart conditions to where they don't really want to do stimulants, or some people, if you use like a blood pressure medication, maybe that won't work for them, or sometimes use Wellbutrin, which is an antidepressant, but maybe, they have a history of seizures, right? And that lowers the seizure threshold. So it just depends. So many factors go into play. But the best way that I can answer that question is to say that meds don't do everything for you, right? So meds are incredibly helpful. They have a lot of side effects, but they're incredibly helpful, in allowing certain neurotransmitters to be present in your brain to help you regulate your attention. So it's kind of like playing baseball. I don't know how many people keep up with baseball, but obviously, like, you have the home base, you have first, second, and third base, and you come back around home and then you score. So I said the meds get you to like third base, right? So the meds do, like, in my opinion, like maybe like sometimes 75 to 80% of the work if they work for you. And I believe that the stimulants are some of the most effective medications in psychiatry, like, might be the most effective. But I do understand that it doesn't work for everybody. So some people, they really work on their diet, do a lot of exercise, a lot of meditation, might, stay away from alcohol and drugs, or keep a good support system, or do therapy. So meds are not completely necessary. So a lot of people are able to manage ADHD without medications and good therapy and good exercise, but it's always something that people, I think, you should at least consider, or be open into it. Sometimes people will be on it for a while and go off, and then, be on and off, back and forth. But I don't think it's something that's absolutely necessary. I don't think it is.
Well said. Thank you for that. Um, Anyone else have any questions? Okay. With that being said, I don't think that there are any other questions. Let me check the chat box. All right. So it looks like that's it for questions. Again, guys, last chance. All right. So it.
Well, I just want to express appreciation to the young doctor and to you
Thank you.
for the job well done, and for helping so many and encouraging so many people in need. Just continue the great work, man, and God bless you.
Thank you so much. God bless you too. That means a lot.
Thank you. Thank you, brother Minister Hayes. It's actually a preacher right there. From the West Side Church of Christ in Rochester, New York, my hometown. So
Awesome.
thank you for joining us. Yes.
Yes, sir. Yes, sir.
Yes, sir. So with that being said, Dr. Sarfo, I want to thank you. Wait a minute, Lisa, Simon, you guys can unmute yourselves, guys, and talk, because I don't want to like end this while someone's typing something up. Another person asked, what's the importance of exercise dealing with mental health in general?
Yeah, so exercise, like, a lot of people, when they ask me for natural remedies, I think exercise is probably, one of the best antidepressants that we have. Like, when American Heart Association recommends, I think, like 150 minutes of aerobic exercise. But just when you go out there and you put your body under a little bit of stress and you're working out, it's a release. Like, you're gonna allow yourself to, mentally, you're not thinking about your issues, and, it keeps you, it can boost your self-esteem, it keeps your body looking good, it keeps your cardio up, it's great for your heart. And with exercise, of course, that one thing might not solve everything, but, the body is not meant, in my opinion, the body is not meant to be like stationary. Like, that's why when people have surgery, like a day or two afterwards, they try and get the person to move, right? You can have blood clots, things, bad things happen when you keep your body, like, not moving, stationary. So just moving your body, I think, the way our bodies were designed by God, if your body's your temple, like, that's how I believe. Like, I have to, this is the body that I have for life, and I want to live a long and productive life. No, obviously, I mean, some people smoke and drink and live to be 80, 90, right? So nothing is guaranteed, but exercise does wonders for the brain. It can help to release some neurotransmitters that you have to take medications to get in your brain. So that's my number one natural way of treating mental health conditions. It's not a replacement for medications or therapy, but it's more so like a adjunctive treatment.
Well said. Another asked, what do you think about essential oils?
Yeah, so I know a lot of times, so I'm from Ghana, West Africa, and we have a lot of natural ways of doing things. Like looking at the evidence, I haven't seen essential oils to, like if let's say we want to use essential oils for depression, right? One way to know if it's helpful is, you'd want to do some studies, right? Some strong studies, randomized controlled trials, meta-analysis, things like that. And you'd want to compare essential oils to the things that we already have, right? So antidepressants or TMS, which is transcranial magnetic stimulation, or ECT. ECT is actually the most effective thing for depression, electroconvulsive therapy. So if we did a study and essential oils beat antidepressants and they beat ECT, at that point, right, we would be recommending it for people who are depressed or anxious or whatever the case may be. But I haven't seen any studies, that say that essential oils are better than placebo, or that they're better than what we currently have for mental health conditions. But some people just they live by their essential oils, and I'm a fan of looking into everything from essential oils to even psychedelics. I think we should be pouring money, and I know the government has money. I know people have money out there to look into these studies. So I'm a fan of looking into these studies to see what we can do to help out. But as of this moment right now, I haven't seen essential oils to beat what we currently have.
Mhm. Very well said. Any other questions?
I think I saw a question about something on the spectrum. If you could read it out.
Let me see. It says here, how do you get off benzos? I think she means benzodiazepines.
Oh, benzos. So benzos, as you know, Doc, benzos, they work similar to, like alcohol. Like, when you're drinking alcohol, the receptors that alcohol works on is very similar to benzos.
Mhm.
So with that being said, we know alcohol withdrawal can be a very dangerous thing. So when you're coming off of a benzo, it's very important to do that with a healthcare professional. Normally, like I had a 3-month telepsych contract at a jail in Virginia. I was here in LA, but I was seeing patients back in Virginia. And whenever somebody will come in and we're trying to wean them off of a benzo, we take them from, like, let's say they're taking Xanax, and then we'd use like a benzo with like a longer half life, like a Klonopin or something like that, to taper them off over time. But it's very dangerous to just stop a benzo cold turkey. You want to do it with a healthcare professional over time. So that's something that some people do cold turkey, but for it depends how long you've been taking it, how your body adjusts to it. But especially for benzos and like people who if you struggle with alcohol, please do that under the guidance of a healthcare professional, a qualified healthcare professional.
That's right. Very well said. So it's gradual tapering, and certainly with the supervision of a health professional, because you just don't want anything to go wrong.
Right.
I see Lisa has a question. She raised a hand. Lisa, why don't you go ahead and ask your question?
Okay. First, I want to say big kudos to the doctor for his journey and sharing it with other people. I think it's you should be extremely proud of yourself.
I appreciate that.
I have a daughter that's on the spectrum, high functioning, but still a lot of support needed for the emotional boosting and her self-esteem. And I think your story can help her, because I think when you're a parent, you try and guide your child based on what you see, but often in a spectrum's mind, the way they see the world is a little different, and
Right.
you can't really put yourself in their shoes, but you try and guide them. But I think they, at a certain point, she's 21 and she wants to go on her own trajectory. So what would be your advice to me to help her find her path safely and yet be at peace as a parent?
Right. So I think, thank you for your kind words, first of all. I don't think there's like a one size fits all answer for this. a lot of times as a parent, if you know how your child is, you can sometimes like simply ask, how would you like to be supported? And that's something that I was given that advice to help me with my patients and with my family members and people in my life that I care about. And it seems so simple. Like you ask them, how would you like to be supported? And especially with individuals on the spectrum, they see the world differently. They might have a hard time, following instructions or taking, certain things to heart. So what, especially for people on the spectrum, one thing that I would say is if you can highlight their strengths. So a lot of times people on the spectrum have like special interests that they're very interested about, and they may know more about that topic than anybody else. So if they have like a special interest or something that they're passionate about, we could use that as like the focal point and, lean into that. Like, hey, I know you're very passionate about X, Y, and Z, or about sports or makeup or this topic. How can I support you with this? And then when you do some research right into that thing and you support them on that journey, then you build that therapeutic rapport with them, to whereby they like you, they trust you on a more intimate level, because something that they care about, you care about it too, and you can use that as like the gateway to connecting with them more and seeing how they would like to be supported. So that's what comes to my mind when you ask that question.
Great answer, Doc. We have Agrina who has a question. Agrina, go ahead. Agrina?
Oh, I'm sorry. It said the host is not allowing me to be unmuted.
Oh,
Can you
no,
hear
no,
me
no.
now?
Yeah, go ahead.
Yeah.
I don't know if you answered this already because I came late into the meeting, but I'm starting a book about gut and psychology syndrome, and it's the objective of the book is to through foods to solve like psychological problems like anxiety and even as far as ADHD. And I was wondering, what's your thought on that? Like, do you feel like our gut health affects our mental health?
Yeah, so I do believe our gut health affects the mental health, and I mentioned earlier that serotonin, the majority of it is stored in the gut, like 90%. So there's definitely a very strong link between the gut and the brain, and not to be confused with like fixing your diet in the sense that that would cure mental health conditions. I think it will go a long way, but some people think that, okay, if I fix my diet, if I cut back on synthetic food dyes and processed foods, that is gonna solve depression or cure my anxiety. And for some people it does. For some people who are situationally depressed or
lifestyle, they spend all the money, so there is no money.
Go ahead, doctor. Sorry.
yeah, oh my bad. But yeah, for some people it can make a world of a difference. So I think if you're mindful of the things that you take into your body and you use that in addition to whatever therapy or meds or whatever you're doing, that could be a powerful way of transforming your life. And I have a good friend of mine, Dr. Ramsey. He's a nutritional psychiatrist. He has a book called Eat to Beat Depression and Anxiety. And in that book, he has like a lot of practical recipes and things that we can start eating that are good for our brains, like avocados, omega-3. There's been certain foods that have been linked to help out with like ADHD and executive functioning. So leaning into those things can be very powerful. I think it's something that, like, you're writing a book on that, more people should look into that. But as long as we let people know that foods by themselves don't make you depressed, but like if you're depressed and then you're not eating nutritious foods, like you're making it that much harder to come out of that depressive funk. But that relationship is one that I think it should definitely be explored more.
And what was the book called, Doc?
Uh, I have somewhere here. It's called Eat to Beat Depression and Anxiety by Dr. Drew Ramsey.
To beat depression and anxiety. Thank you
Mhm.
so much. Now, Sarah Higdon had a question. Go ahead, Sarah.
Yes, I want to know. I wonder if I'm ADD. When I go to do a task, if I start in room A and have to take something to room B, when I get to room B, I start doing something in room B. Eventually, I get back to room A to
Right.
finish what I was doing there. So does that mean that I have ADD?
So, well, first of all, ADD is people
Attention.
It's now we call it ADHD, so like it's all under one umbrella. ADD would be like the inattentive form of ADHD, and everybody, in my opinion, oh,
Go ahead.
oh, uh, anybody, everybody, in my opinion, will struggle with some of the core symptoms of ADD or ADHD. Let's call it ADD. Every now and then, right? So everybody might be a little bit more forgetful from time to time. You might be more disorganized, or you might have like 20 tabs open on your computer screen. But for somebody who has ADD, it's going to significantly impair many aspects of their life. Like it's going to impair your relationships. It's going to impair your you at work. You might have a hard time keeping a job because you're either late all the time, or you keep getting fired, or you can't stay focus on a certain task. Or if you are going from room A to room B to back and forth, and you forget to pick up the kids, or you're having issues, maybe you forget your spouse's birthday or a commitment you had, like the impairment that people with ADHD experience is quite significant to where it dominates their life. And a lot of times, I feel like women are diagnosed later in life too, because there's referral bias. So when we think of ADD or ADHD, you think of like a young hyperactive boy, but women more so present with the inattentive signs, like disorganization, having a hard time with instructions, having a hard time keeping up in conversation, accidentally cutting people off mid conversation. And for women, it's sometimes society will reward you for those symptoms. Like if a lady seems to be like quiet and like to herself, she might be seen as more like ladylike and polite, whereas she could be struggling silently with this thing. So a lot of women are diagnosed in 20s, 30s, and 40s because they never got the right referral in their younger days, whereas men are sometimes diagnosed a little bit earlier. So even as an adult, there is a chance that somebody could have ADHD, and the only way to know is to get a formal evaluation.
Okay. I think I may not be there. Okay, thank you. I enjoyed your presentation, incidentally. God bless you and your work.
Thank you, Miss Sarah. I appreciate it.
Thank you for that, Dr. Sarfo. Are there any other questions? Okay, I don't see any other hands raised, so I'll take it that there are no more questions. So I certainly want to thank you, Doctor, for joining us once again on the Self-Care Forum. Thank you for giving up this much time in your busy schedule to just sort of educate us and share this wisdom with us. I think just going back to Scripture, Hosea chapter 4 verse 6 says, "My people perish for lack of knowledge." And so that's the whole purpose of the Self-Care Forum podcast, to invite health professionals, wellness professionals that are going to give us that wisdom so that we can do better because we know better. So I want to thank you. Do you have any closing statements before you go?
No, I just want to say thank you for this opportunity to educate and hopefully inspire some people. And you never know who's watching, and maybe somebody takes the information and it helps them or helps somebody else. So anytime I get the chance to do one of these, it's a blessing. I really do appreciate it.
And with that being said, I want to thank everyone for joining us this Sunday afternoon, well, evening rather. At least it is in New York State. This video will be available midweek, so by Wednesday or Thursday on my YouTube channel. So I want you all to stay tuned for that. Dr. Cedric is the channel. I will be giving you the video as well, Dr. Sarfo, so you can share it with on whatever platform you wish. So I want to thank you guys. I want to thank you, Dr. Sarfo. Everyone, have a good night, and thank you again for joining us.
All right. Thank you for having me. I appreciate it.
All right.
No problem.
Thanks again. God bless.
All right.
Bless you, Cedric. Thank you.
Thank
Take
you.
care.
All right. Bye-bye. Listen to the audio version of the Self-Care Forum podcast on Spotify, Breaker, and Google Podcasts.